physicians and the medical community now referring to central weight gain as killer fat. It seems that everyone else simply feels that if they're gaining a little weight around their middle, that it's just a cosmetic problem. However, it is important to realize that central weight gain is just one aspect of a constellation of problems that is now referred to as the metabolic syndrome or prediabetes. When you develop prediabetes, you become less and less sensitive to your own insulin, and your blood pressure begins to rise. Your very bad cholesterol increases, that good HDL cholesterol goes down, your triglyceride levels increase, your blood sugars begin to rise, and you are at very high risk of developing both heart disease and diabetes. Therefore, this central weight gain is just a sign of the serious metabolic changes that are occurring in your body that is causing your body to age much faster than it should. Once you begin to appreciate the fact that it's not just a problem of an expanding waist size and your clothes are not fitting as well, but instead a serious sign that your health is under attack, you can see why I, as a physician, consider it killer fat. This is why I simply take out a tape measure and measure my patient's waist 1 inch below their belly button and across the hips during every routine physical exam. I become very concerned when I note that a patient's waist size is expanding. Now, when a woman has a waist size greater than 32 to 33 inches, or a man has a waist size greater than 36 inches, I become very concerned that they are already developing early insulin resistance and this metabolic syndrome. And when a woman's waist size is over 34, 35 inches, or a man's waist size is over 40 inches, they usually have the full-blown metabolic syndrome. Once patients have developed the metabolic syndrome, their arteries begin aging about a third faster than they should, and they are at very high risk of having a heart attack, a stroke, or developing diabetes. If you continue to live your life as you always have, this problem just becomes worse and worse. You can begin to see now why just gaining some weight around your middle is not just a cosmetic concern. It is just evidence of a more serious underlying problem. I have also learned over the years that when my patients have underlying insulin resistance, that they just can't lose weight. They literally hold on to fat like a sponge holds on to water. Therefore, when I begin documenting an expanding waist size in my patients, I begin educating my patients about what they need to do to improve their lifestyles in order to reverse this problem and slow down this aging process. When they become aware of the fact that this kind of weight gain is an early sign of a more serious health problem, they certainly become more motivated. The best way to reverse this problem and slow it down is to firmly establish healthy lifestyles that actually improve insulin sensitivity and allow you to tip back into a normal metabolic state. This allows you to not only lose this central weight gain, but also lower your blood pressure, decrease that bad cholesterol and triglyceride levels, increase the good cholesterol, and improve your blood sugars as you slow down this aging process. This is why I have developed my online Healthy for Life program located at healthconceptsint.com. I literally take you by the hand and guide you into these new healthier lifestyles that teach you how to protect your most valuable asset, your health. This program guides participants into simple, doable healthy lifestyles that have been shown in clinical trials to improve insulin sensitivity and allow you to permanently lose this fat around your middle as you improve your health.